Oh, hello, and welcome to our webinar about automating the fulfillment of medical record requests. My name is Tom Seco, and I am the Business Development Manager for DAS Health. Before we get started on today's webinar, I want to cover a couple items regarding the webinar itself. I want to let you know that this webinar will be recorded, and then two, everyone's phone will remain muted throughout the entire webinar. So if you do experience audio issues, please use the chat box to let us know so we can resolve them. And I also want to let you know that there's not a one-size-fits-all solution for the ideas that we express in today's webinar. I would also like to introduce Joe Scholes. Joe is our Product Solutions Director. He and his team developed the solution that we are talking about today. This is an agenda for today's webinar. I'm going to take about 90 seconds to introduce you to DAS Health. And then I'm going to take you through a couple slides to kind of lay the foundation for what you're going to see in the demonstration. And then I'll turn it over to Joe, and he'll take you through the demonstration of the ChartGuard OnDemand solution. And at the end of the presentation, we'll answer all of your questions. So as you think of your questions, you may enter them and type them into the questions area of the webinar control panel whenever they occur to you throughout the today's webinar presentation. So who is DAS Health? Well, we are a leading provider of health and IT management solutions and a trusted consultant to many physician groups, hospitals, and healthcare systems across North America. And we have 20 plus years of experience with NextGen. We have a broad and deep portfolio of services. We have over 200 employees in the company and have worked with over 425 clients that use NextGen. Our passion is to work with our clients to improve patient care, work with our clients to enhance the patient experience, and work with our clients to maintain a financially healthy practice. Our mission is to improve the healthcare experience by delivering the highest value health, IT, and business solutions to our clients. During the 20 years that we've been working with NextGen, we've developed a strong relationship with NextGen itself, and we will continue to develop that relationship with them over the coming years. So bottom line is, we're here specializing in NextGen and keeping our focus on you. We're here to help and serve you in any way that we can. As I mentioned, we have a portfolio of services that's broad and deep, and this is a look at our service areas. I'll point out that we've divided it into 3 areas: practice management, information technology, and patient care. The solution that we're talking about today, that automates the fulfillment of medical record requests, falls into the productivity, products, and enhancements area of practice management. So that's a little bit about us. What I thought I'd do is just take you through a poll just to answer a couple questions, if you don't mind. The first question is, how many hours do you typically spend fulfilling medical record requests? And is it less than 5 hours a week, 5 to 10 hours a week, 11 to 20 hours a week, or more than 25 hours a week? And I'll give you a couple more seconds to fill that in. And I'll close it out in 5, 4, 3, 2, 1. We'll go ahead and close it out. I'll go ahead and share that with you so you can see how others have responded. So it looks like quite a few is more than 11 hours and quite a few at more than 25 hours. And a quarter less than 5 hours a week. So thank you for that. Second question is, what is the volume of patient medical histories you typically generate each week? Let me go ahead and launch that. And is that less than 10 hours? I mean, less than 10 medical record requests a week? 11 to 25, 26 to 50, 51 to 100 in a week, or more than 100? Okay, I'll give you 5 more seconds. So 5, 4, 3, 2, 1. Go ahead and close that out. And then let me share that with you so we can see. So about a third, 51 to 100, and about a half between 11 and 50 per week. So we close. So one more last question. What frequency do you typically process medical record requests? Is it a daily task? Is it a weekly task? Is it a monthly task? Is it, immediately upon request? You receive the request and you immediately fulfill it. Give you a few more seconds on that. 5, 4, 3, 2, 1. Go ahead and close it out. And let me share that with you. So it looks like 80% it says it's daily task and 20% says it's immediately upon request. So thank you very much for going through that. Okay. So back to the webinar. So as I mentioned, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. And if you do experience audio issues, please use the chat box to let us know. I think just one other comment, the products that we all developed, that Joe and his team developed over the years, there's really 3 common themes to what came out of those products. And the 3 common themes is 1, making the job easier. 2, make the process more efficient by streamlining it or automating it. And then 3, saving people time and effort. I think you see those themes in all of the products that we developed, and you'll see that in this particular product as well. So why do practices and health centers use ChartGuard OnDemand? Well, they use it to automate a very time-consuming and manual process. You receive requests from insurances, from attorneys, from individual patients, and even from your own internal staff. What you see up here is just some examples of why requests come in for medical histories, into your organization. Insurances, submit requests for audit purposes and for review purposes, and sometimes you can get a request from an insurance in which they're asking for, medical histories of 50 to 60 patients in one request. And we've even talked to practices that said they've received requests for up to 500 patients from an insurance. So you're getting that type of value from our, on a particular request. It takes a long time to do it in the gathering the information that they are requiring. So the other reason that organizations purchase ChartGuard OnDemand is to free up people's time so they can work on other tasks. Some practices have, and some health centers have, a person or multiple people dedicated to doing the work, and sometimes when there's multiple people doing the task, they're not spending all their time doing it. So you could have, maybe 3 people doing the work that 2 full-time people could be doing. So keep those types of thoughts in mind as you're thinking about automating the process of fulfilling medical record requests. This is just a slide that shows statistics of questions that I just asked, based on the history of our responses from clients and prospects as well over the years. So as you look at these numbers here, the total percentages add up to be over 100% because on occasion we received multiple responses, from the same organization who differed in their response. So on the left-hand box is about, how frequently the organization fulfills medical record requests. And you see here a majority of it, the work is to fill medical record requests, within the week that it's received, so either on a daily basis or on a weekly basis. The center box is about the number of hours the organization spends fulfilling medical record requests. So you see here that the time spent working on fulfilling the request is split between 4 hours or less per day or more than 4 hours a day. or less than half a week, or more than half a week of the time spent fulfilling medical record requests. And the right-hand box is about the volume of the medical record requests the organization fulfills on a weekly basis. So you see here, 30% fulfill 5 or less medical records each week. 70-80% fulfill more than 25 medical record requests a week, and more than half fulfill more than 50 medical record requests per week. So just kind of giving an idea of where you fall based on the responses that you gave today, how you compare to other organizations as well. So, how does the ChartGuard OnDemand software work? Well, it's a NextGen Add-On Product that gets added into your system. You launch it from the add-ons menu within NextGen. It has an interactive user interface that allows you to choose to generate a particular chart for a single patient or for a range of patients. You can generate the information in a chart based upon rendering provider or financial class or within a range of encounter dates. It generates a PDF file, making it very easy to read, very easy to send out to the requesting party, and it can run against the report database, meaning that it doesn't have to go against your production database and slow down performance there. So with that, I'm going to turn it over to Joe, and Joe's going to take you through the demonstration of the product. And again, as you have any questions, please enter them into the chat box there, the questions box.
All right, thank you, Tom, and thank you everyone for joining us. We're going to switch over here to the demo environment, and then I'll take you through how this application for ChartGuard OnDemand works. So I'm going to go ahead and just get some charts launched and running here in the background while I take you through it. So you can kind of watch along with me, but I'll come back and explain everything in just a moment. So I'm going to queue these up and do a request and submit these to be processed. So the user interface for ChartGuard OnDemand is very straightforward. In the upper left here, we have the search criteria for the population of patients that you're looking to produce charts for. So you can go for direct hits based on first name, last name, date of birth. If you have a list of numbers in NextGen, person number, MedRec, you can go ahead and enter those in and pull up exact matches if you're just doing one. If you're doing a request for an insurance or for legal purposes, you can go ahead and slice and dice by things like the primary care provider, the financial class, the initial encounters that you're looking for a hit within. And then if you get a hit on any of these, how far back do you want to go with the encounters that you're looking for? How far back in the patient's history do you want to go? So that way you don't have to pull their whole history for 10, 15, 20 years worth of information. You can just deliver what's needed for the particular request. Now, one of the things we discovered early on when working on ChartGuard OnDemand was A, the amount of time practices spend on these requests, and B, the amount of that time that's spent kind of cutting, pasting, collating, manually assembling reports out of various different outputs from NextGen. So what we wanted to do on ChartGuard OnDemand is give you a way to find the patient population easily, but also to define what you need in those reports. And what ChartGuard OnDemand is going to do is it's going to produce a PDF file per patient that you can then deliver to the other party. So if we look over here on the upper right, these are different categories of information that we can pull in here. And it includes everything, histories, problems, so all your module data in NextGen, EHR documents can be pulled in here so that you have kind of those historical snapshots. And then we can also pull in items from ICS Document Manager that would be relevant too for that particular kind of request. We can pull in financial information from the account summary if it's needed, sticky notes that are in there. You get to pick and choose what you want, and in fact, you can set up multiple of these definitions based on the different types of requests, right? For insurance companies, they may want something different than legal. than an individual patient who may want their full lengthy history delivered to them. So this way you can set up several of these different chart definitions that all include the appropriate items that you need. And the goal here is to save you from those kind of art projects where you're printing things out and collating and cutting and pasting. So even within these, we can go ahead when we come down to things that aren't encounter bound and set up the depth of those. So in a particular ICS category, do you want the last several of those? Do you want them within so many months? Some combination of that. So we can capture that so you don't have to redo it each time. You can go ahead and save that knowledge for that type of request. So in the upper left here, you're picking the patients. In the upper right, you're picking the deliverable, what you want in the charts. And then you pull up the list of potential patients. And like I did before, we can go ahead and select individual ones that we want from that list of hits and send them off to be processed. Now, the cool thing is, and kind of what you're seeing here, is this processing doesn't lock up the workstation. It happens in the background. We offload it to a ChartGuard engine that runs on the network that, while I've been talking, has been producing these charts for this set of patients. In fact, I can come back in here and select all and look at the history to see if these have been done yet. So I can see the request just went in a few minutes ago, and fortunately I talked long enough where these charts got completed. Now I can go ahead and pull the charts up individually from here and view them. I'll do that real quick just to show you what's in the charts. So each one is a PDF file per patient. The name of the file is the last name, first name, and date of birth so that you can sort them easily, especially when you're handing them off. It starts with a cover sheet about the patient and their insurances, and then it has great information in there like the allergies and medications and problems, all those things that you picked or didn't pick build out what's going to be in here. If they're using these electronically, we do bookmark each section so you can easily jump to what you're looking for. All right, so for the party doing the audit or yourself, if you're auditing these before they're going out, we can go ahead and give you those bookmarks so that you can immediately go to that section and make sure, yeah, I got that in here, this looks complete, and now I'm going to send it out. Now, if you are sending these out in bulk, we can deliver them to a folder that you give access to, and then we could drag these up to a secure web portal where they're going to be delivered, to an encrypted thumb drive or hard drive that they're going to be delivered on. So you work with the other party to decide what the delivery mechanism is. The point of ChartGuard OnDemand is really to speed up the creation of the charts, that extraction into a simple, easy to read PDF file. And again, you can see here how they're named, and I could go grab these and go ahead and upload them for the other party to see. So as mentioned, it can run against the report server. It doesn't have to run against your live database. Normally you're looking for histories anyway, so the few hours you've been open already today really becomes inconsequential. You can run it against production if you need to, but most of our clients run it against the report server. So we take great care to keep improving and adding to the user interface. So the search criteria we see up here, that list is always growing based on the feedback that we've heard from practices like yourselves who are out there in the real world having to create these. So this is ChartGuard OnDemand and how it works. I'm going to go ahead and turn it back to Tom to finish up, and then we'll take your questions.
Okay, thank you, Joe. So you just saw how you can automate the fulfillment of a medical record request, and now that you've seen how our solution works, you can probably now imagine how the solution can save significant time for the people who do the work. So we realize each of your practices and health centers operate a little differently with the processes that you have in place. So as I mentioned in the beginning, there's not a one-size-fits-all solution. So we encourage you to contact us and let's talk through together, your processes and your issues, and see how this solution can be used to save your staff significant time and effort. This would also give you the opportunity to ask questions as it applies to your specific processes and scenarios. So with that being said, now we'll answer any questions that you have. So there's a question here. Is there any concern of EPHI lingering out in the system that we need to be aware of?
ChartGuard OnDemand generates the charts into the designated folders that you specify, so you can keep track of that, and you can go ahead and clean that up after you're done with the charts and they've been delivered to the other party.
Here's another question. Is there any logging done in the system of the history being generated?
Yes, even if we're running against the reporting database, we will write to the production EPHI log and create an entry that ChartGuard did an extraction to PDF for each patient. So that'll be logged in there, so you'll have that. Additionally, ChartGuard within its own tables will keep track of the requests that it's handled too. So you really end up with it in two spots.
Here's another question. We have an interface to the radiology department of the hospital. Can we access those images?
ChartGuard OnDemand is focused on the NextGen database. So if you do have some of those images flowing into ICS or elsewhere in the EHR via an HL7 interface, we can pick those up. But unfortunately, we today do not pick up from other systems outside of NextGen.
Can we get printed page counts?
Printed page counts is a feature that we're working on. That's one that came to us recently, so that'll be in future versions. One of the reasons we've been asked to do that is sometimes practices will bill the other party based on the number of pages. In the meantime, you could just look at the PDF files and the number of pages per PDF file and bill that out. But as always, we want to make this more user-friendly, and if it's something that a lot of practices are using, build that into ChartGuard OnDemand itself.
So we have another question came up. We have a hosted environment. Can ChartGuard OnDemand run in that hosted environment?
We have clients who are using ChartGuard OnDemand both in on-premise environments and in hosting environments. We can go ahead and work with you in the hosting environment to get ChartGuard OnDemand set up and running.
Just one other question. Is billing information available?
The billing information is available via the account summary section of the chart. If there's more information that's needed, again, we'd be glad to sit down and talk to you and see what else would be needed aside from the account summary, which kind of gives you the overall history.
Another question, does this work for FMLA requests?
For that one, again, we'd want to sit down with you and find out what bits of information you need, because we're pulling the information from NextGen. So one would think we'd be able to find the bits that you need for your particular FMLA requests.
If there's any other questions, go ahead and type them in. Otherwise, if there aren't any other questions, we'll go ahead and close out the webinar. You see our contact information up here on the screen. So you have our email address and our phone numbers. You can give us a call or send us an email if you have any other questions that come up over the next few days. And we'll get the information that you need. As I mentioned earlier, if you'd like to have a more in-depth discussion about ChartGuard OnDemand and how it would fit within your organization and work within your organization with your current processes, we could talk through that as well. I'm more than happy to have a more in-depth discussion about that. So if there aren't any other questions, we'll go ahead and close out the webinar and give you back a few more minutes in your afternoon.
Again, thank you everyone, and have a strong finish to your week.
Thank you very much.